Thank you for joining us. Today we break ground on the next significant advancement in the university's growth and in our development. The nation's healthcare industry is, as we all know, is in the midst of some very significant changes, probably the most transformational changes in our lifetime, and it's becoming not just about treating individual symptoms or diseases, but it's about preventing those diseases. And healthcare must address and improve the range of factors that influence our health and our quality of life. And this building is a major part of that because our health science faculty is vital in preparing the next generation of healthcare leaders to take on this enormous challenge. The first classes will begin being held in this 81,000 square foot building in January of 2022. It will be home to exercise science, clinical physiology, nutrition, paramedicine, and public health programs. Several graduate programs also exist in the health sciences, including a new Master's of Public Health degree, for which the first classes are being held this quarter. Our current health sciences programs, as you all know, are located in 6 separate locations across our campus, and they've never had a home base. They've never had that space where they can work together to collaborate, and frankly, they have simply outgrown the makeshift facilities that are currently being used. This reason includes the changes in healthcare, as I mentionedly said, but also the rapidly increasing student interest in healthcare fields. So this new $60 million facility, state-funded, will include the cutting-edge classrooms and laboratory spaces to accommodate up to 630 students. This project will be the culmination of our multi-year campus master plan the development of a health science neighborhood, which includes the buildings of Dean, Science, Discovery, Samuelson, and soon the Health Science Building. It will add to the state-of-the-art science, technology, engineering, and math-related academic facilities we have been committed to provide for our students. And as you know, during my recent State of the University address, I put forth sustainability as a continuing goal for the university, and this building will be in line with that charge. As a green building, we are optimistic that it will receive a Leadership in Energy Environment Design, or LEED, gold certification from the U.S. Green Building Council. The construction will also generate nearly $1.5 million in permit, plan review, and impact fees for the city of Ellensburg. It is expected to create 140 construction jobs and produce millions of more dollars in sales tax. And I want to acknowledge both our general contractor, T.W. Clark of Spokane, and LMN Architecture of Seattle, who along with our outstanding health sciences faculty have designed a modern, functional, state-of-the-art facility. This important project will pay dividends for our students, our community, and ultimately to the health and welfare of the citizens of the state of Washington and beyond. It is now my pleasure to introduce one of the faculty members who led the planning and the design effort for this building, that individual being Dr. Ethan Bergman. This facility, for which we are breaking ground today, is part of his and his colleagues' work. It's my pleasure to introduce Dr. Bergman. And if you need it, thank you, sir.
Thank you.
And I'll leave you this if you want it, or you can use yours.
Okay, thanks. Well, thank you, Dr. Gaudino. On behalf of Central Washington University's Department of Health Sciences, I'd also like to welcome and thank you for being here today to lead this celebration that we are starting. We believe this groundbreaking is the start of some great things for our Department of Health Sciences, but also for the university, and most importantly for the students and the graduates that we serve. Thanks for all those who have been involved in this process from the beginning. President's office, our dean's office, all the faculty in our department, facilities, the legislative liaison, and all the people around the state. Now, when we started dreaming about this building, I had a full head of hair, and my beard was about the color of this dirt. And also I think Dr. Gaudino had a full head of hair at that point. So we've been dreaming about this for a long time. Health sciences is one of the newest departments on campus, but although we're one of the newest, we're one of the largest. As Dr. Gaudino said, we have over 600 majors and minors in our department. As you also know, healthcare careers are among the nation's most rapidly growing professions. And as Dr. Gaudino said, the student interest is there as well. This new facility will provide our students with well-designed, modern laboratory spaces that will allow for experiential learning. As you know, you can only learn so much by watching and listening, but you have to do things to learn how to do things well. And these laboratory experiences and the spaces that are in this new building will allow for students to experience and really understand the type of care that they're going to be providing to the people that they serve. But it's not only the people in the health sciences department that are going to be benefited by this. We're going to have students across the university. We're going to have students in our general ed programs and courses, and also in the sciences. You know, along with aiding our health sciences graduates who enter careers directly as registered dietitian nutritionists, as paramedics, and in the area of public health, we also will provide a broad pathway for other students to enter professional training in other areas, such as physical or occupational therapy, enter medical school to pursue careers and as a medical doctor or doctor of osteopathy, as nurses, as chiropractic practitioners, many other career choices that people can go into. Or they can enter graduate school to pursue PhDs and doctorates to really contribute to the knowledge base and also help to educate the next generation of students. So this facility will allow for that to happen, and also it will allow for us to continue a partnership we have with the Yakima Valley Interprofessional Education Collaborative, which provides additional learning opportunities for our students. So this building and our health career programs will all work together to benefit our students in our region, especially because there's an increasing healthcare need in the central corridor of the state. It's known that graduates tend to gravitate to careers where they receive their training and their degrees. And this facility and the education that we provide through it will be one of its only kind in this area of the state, in the central corridor, from the Cascades to the Palouse, from the Canadian border to Oregon. And we especially are excited that a lot of our graduates will come back to practice in this area. While this facility will be important to our students, it's also going to be important for our faculty, who are also contributing in their work and their research. And to discuss these aspects, I'd like to introduce another faculty member in our department, distinguished faculty Vince Nethery, who is the director of our clinical physiology division and also has contributed greatly to this program and to this facility design. So Vince Nethery, please come up. You need this? You got it? Okay.
Thank you, Ethan, Dr. Gaudino, faculty members from the Department of Health Sciences who are here, other individuals from the campus, LMN Architecture, TW Clark, and anybody else who's here that aren't covered in those categories. We're delighted, absolutely delighted to be here today to share this time with you. Dr. Gaudino, a few minutes before we started, asked me, did I ever think it was going to happen? I said, well, yes, we hoped. And when we balance all of the elements that go into a planning project like this, you never quite know where the hiccups are going to be, and you never quite know around which corner is going to be some benefits. We've negotiated all of those through hiccups in state legislative funding, site locations, and a variety of other factors. And we're absolutely pleased today to be here to dig the first hole in the ground. The prospect of teaching classes, educating students in the well-equipped laboratories of this building, engaging in collaborative research with students, is one that I and the faculty, all the faculty in health sciences, are anxious to begin. Most of the faculty in health sciences spent a lot of time over the last decade, probably closer to 12 years, working on the planning aspects. And it would be remiss not to recognize the tremendous relationship that was developed among the programs of the department, LMN Architecture, who are represented today by Wendy, who's been part of the project for that entire time, and one other individual, Chuck Lissett, who is coming on as overseeing the construction component, and RFD Laboratories, who is a consultant with LMN Architecture. There's a lot of time, hours, and energy that went into initial components, modifications of those, expansions of them, contractions of various components. And the relationship we developed with those groups was phenomenal from our perspective. And I believe LMN felt the same way as well, as did facilities on the campus. In addition to us as faculty being educating the students of the programs in there, we're also looking forward tremendously to the intercollaborative arrangements that we can establish with other faculty members on the campus. Many of the health science areas are interdisciplinary in nature. They take courses in chemistry and physics and biology and psychology. And the opportunity exists by having a facility that is both modern, well-equipped, and centrally located within the science neighborhood. Provides a tremendous opportunity to increase the level of collaborative relationships that exist amongst all of those interdisciplinary components that contribute. The facility will offer some unique types of research components as well, where the faculty and the students can engage in both inter-faculty research, but also collaborative research with students at undergraduate and graduate levels. And that's one area where the institution has prided itself on the integration of students into the research process. And we look forward to being able to share those facilities with those students and help them engage in active experiential learning. Distance education is a fairly new area to both health sciences and to the campus as a whole. And the facility will provide the opportunity to integrate within the components of it the most recent elements that are going to facilitate distance education. Public health is a critical area where distance education is going to expand to communities well beyond the campus, well beyond Ellensburg, and across the state, if not further. Paramedicine also is establishing a significant distance education component, and we look forward to extending CWU's reach well beyond the local area here. Recruiting faculty is always a bit of a challenge in a small community like Ellensburg and a small campus like CWU. This facility will not only provide the opportunity for new faculty to maintain and contribute at their current levels, wherever they may be coming from, but will also be a tremendous attraction to faculty who are going to come down the road. It'll be a wonderful recruiting tool for faculty within the health sciences and within the sciences in general in looking at the integrative nature of the programs and the facilities. Lastly, one member of the Facilities Committee who has been integral to this project from its very inception I would like to introduce him as the individual who will lead the digging of the hole process, and that is Doug Ryder, who is with the facilities management. He's an architect with facilities. Doug has been integrally involved in the project since we first started to begin conversations about it, and much of the success from an institutional perspective can be laid on the hard work that Doug has done and the rest of facilities as well, but he's been our lead person on that.